Hello, my name is Dr. Dewan S. Raja. Today I will discuss about histology of the Palatine tonsil. The Palatine tonsils are a pair of almond-shaped or oval masses of lymphatic tissue located at the oropharynx between the palatoglossal arch and palatopharyngeal arch in the tonsillar bed of the oropharynx, just above the posterior aspect of the tongue. Histologically, the palatine tonsils consists of several components. Number one, epithelium. The surface of the tonsil is covered by a non-keratinized stratified squamous epithelial layer. Okay, so multi-layered epithelium, non-keratinized stratified. This epithelium provides protection against pathogens and mechanical injury. Crypts, that means depressions or sulcus. The tonsil has 10 to 20 invaginations called crypts, which increase the surface area. These crypts are lined with epithelium and contain lymphocyte and other leukocyte like neutrophil. Okay, so identifying points: epithelium. What type of epithelium? Non-keratinized stratified squamous epithelium on the surface, and it goes inside the crypts of the tonsil. So this is also lined by stratified squamous epithelium up to this level. Okay, so we got lining epithelium, non-keratinized stratified squamous epithelium. Then we'll get lymphatic nodules, this. Okay, the lymphatic nodules usually contains the germinal center. In the center of the lymphatic nodule, you will get germinal center. That it has lighter color than that of the periphery, because the germinal center is the site of lymphocyte production, and the lymphocytes there is lighter because they have more cytoplasm than that of the mature lymphocyte at the periphery. Okay, so we got the surface epithelium, lymphatic nodule, and lymphatic nodule with germinal center, tonsillar crypts, that is also lined by the non-keratinized stratified squamous epithelium, and submucosa. Here is the submucosa that is continuous with that of the tonsillar capsule, that is dense connective tissue on the tonsillar bed, that is incomplete capsule. We may also get some of the mucous gland acini here, maybe more than few, okay, like this specimen. We may get even a few skeletal muscle cells from the bed of the tonsil, palatine tonsil. Lymphoid tissue. The bulk of tonsil is composed of lymphoid tissue organized into lymphoid nodules. These nodules contain aggregates of lymphocytes, primarily T cell, B cell, along with dendritic cells. The lymphoid tissue is arranged in a diffuse manner within the tonsil without distinct follicular organization. Germinal center within the lymphoid nodule. Germinal centers may be present. Germinal centers are regions where B cells proliferate and differentiate into plasma cells which produce antibodies. These centers are characteristic of active immune responses. This tissue is underlain by dense connective tissue acting as a partial capsule. Tonsils, like other aggregation of lymphatic nodule, this is a mucosa-associated lymphatic tissue, and it is a mold. It is also a peripheral lymphoid tissue. We may also call it secondary lymphoid tissue. The tonsil do not possess afferent lymphatic vessels. Lymph, however, does drain from the tonsillar lymphatic tissue through efferent lymphatic vessels. Blood vessels and nerves are very important. Tonsil is highly vascularized, it is supplied by multiple arteries, mostly the tonsillar branch of facial artery, ascending palatine artery. It is also drained by external palatine vein, also called paratonsillar vein, and the internal carotid artery may be related to the bed of the tonsil, especially when it is tortuous. Nerve supply, the surface sensation is carried by the glossopharyngeal nerve mostly. Okay, the nerve regulates the function and sensitivity. Okay, we have some clinical point. Tonsillitis, very common problem in the children. Tonsillitis is the inflammation of the tonsil. It may be very large. It may need tonsillectomy, that is the surgical removal of the tonsil. Megatonsil, tonsil may be so large, it may block the oropharynx. The kid or the adolescent boy or young adult may have difficulty to swallow food. Okay, this is large size tonsil that may happen. Tonsillectomy, adenoid is the nasopharyngeal tonsil. Here is the pharyngeal tonsil here. If it is large, we call it adenoid. Okay, Wilder's ring of tonsil, palatine tonsil, lingual tonsil, tubal tonsil, some lymphoid tissue over the thorax tuberous or the pharyngotympanic tube area, and the pharyngeal tonsil. They form a ring at the junction of the pharynx with the oral cavity. This is the oropharynx, this is the nasopharynx area. Okay, and this ring of tonsil is called Wilder's ring of tonsils. Okay, the pharyngeal tonsil may be large, we call it adenoid, that may block the nasal passage, so the child may be mouth breather. Okay, we got that. And that's all about the histology of the tonsil. If you have any question, please feel free to ask me. Please share the information with your friends. Please support my channel. Please subscribe me. Have a nice, wonderful and blessed day. Bye now.